Welcome to an introduction to color and visual stimulus. Today, we'll explore how color affects our vision, how we can measure its impact, and why this matters more than you might think. Color is how our brain interprets the energy of light in the visible spectrum. The image we see is a complex mosaic of stimuli which we interpret as a scene. Different wavelengths mix and appear as a single color, determined by the dominant wavelength. But here's the fascinating part. Our eyes contain three types of cone cells which respond to a range of different wavelengths of light. Each one can only increase or decrease in response to light, and they can be stimulated in the same way by different colors. This is called univariance and is the principle behind color television. But this overlap can lead to confusion in how color is perceived, and in some cases, cause real visual discomfort and other unwanted effects. Visual stimulus issues can manifest in a wide range of symptoms. Optical signs like eye strain, letter distortion, glare sensitivity, and even dizziness. Medical signs such as headaches, migraines, and poor depth perception. Cognitive signs, difficulty focusing, low motivation, and poor comprehension. People with conditions like dyslexia, ADHD, autism, TBI, or anxiety may be especially vulnerable. Who assesses these issues? In theory, assessment can be done by a developmental or neurooptometrist, occupational therapist, or specialty-trained professionals in visual processing. Each should play a role in identifying how light and color affect visual performance, although currently there is little training for professionals. Assessing light sensitivity often starts with questionnaires or a referral to a specialist. Some professionals take specialized training in color theory to understand and prescribe appropriate solutions, from colored bulbs to customized lenses. Assessment methods in color and stimulus are critical, and there are various ways to assess color needs. These include trial and error with off-the-shelf glasses, self-guided assessments, advanced techniques using devices like a read eye, intuitive colorimeter, or syntonics therapy, subtractive and additive methods. Each has pros and cons, and not all are effective for every individual. Why is the use of color so controversial? It's hard to assess reliably. Results vary and may not be replicable. There's a lack of cross-disciplinary research. And, frankly, there's skepticism and financial interests at play. The truth about tints. There's no one-size-fits-all tint. What works in one light might be ineffective or harmful in another. So, if you use tints, you must understand the science behind them. Looking ahead. Tinted lenses can be clinically necessary, but optical training in this area is minimal. That's why, in future videos, we'll dive deeper into the science of assessment and management of color and visual stimulus. Stay curious, and stay tuned. To enroll on the course, please like and register. Most videos will be free, although there will be a charge for assessment and treatment methods for professionals or those with in-depth requirements. Costs etc. will follow on later videos.